And as we look at the latest COVID-19 numbers reported today, the state dashboard shows 5,158 new cases and 3 new deaths. That's after we saw those huge numbers over the weekend. And experts say the next 2 weeks will be telling, with so many people gathering together during the holidays. And those big spikes in cases only straining our healthcare system even more. The number of COVID-19 inpatients at our hospitals hitting another record high today with 4,647. That's according to our state's coronavirus dashboard. ABC 15's Mike Pelton tracking that for us tonight.
It's not just inpatient and ICU beds that are dwindling around the state, but apparently clean sheets? On Monday, Banner Health telling us, quote, due to higher volume of patients and use of linens, we are working with our current vendor to explore additional laundering options as our current vendor at times reaches equipment capacity.
Unfortunately, it looks like we're trending in the wrong direction significantly.
Wendy Smith-Reeve is the state's former emergency management director, who is now an ABC 15 analyst.
What my expectation is that we're going to continue to see the higher numbers, especially after the New Year's holiday. And as the predictors, the modelers have told us that come mid-January, that's really going to be the peak.
From few beds to worsening nurse-to-patient ratios, longer ER wait times, and pausing of elective surgeries, we've heard of tough conditions at hospitals all across the state. However, we have not heard of any hospitals having to triage patients, meaning doctors deciding who does and doesn't get scarce resources. That is part of what's known as crisis standards of care.
That is the last domino to fall.
Similar to what we've heard from other hospital systems, on Monday, Dignity Health telling us they are operating one step down in contingency standards, which, according to state criteria, includes repurposing patient care areas and finding ways to expand staff and conserve supplies. Crisis standards, a milestone every hospital wants to avoid.
Doing the same thing over and over again, expecting a different result, obviously is not working. So greater mitigation efforts definitely need to be put into place.
More than 9,000 COVID-19 deaths in Arizona and counting. Mike Pelton, ABC 15, Arizona.